Good morning. Welcome to Sunday's edition of Facebook Live from AVP Research Foundation. And today we are going to discuss about a condition called ankylosing spondylosis. I will be bilingual today because I would be speaking a little bit also in Hindi as well as English. नमस्कार, मैं डॉक्टर सोमित एवीपी रिसर्च फाउंडेशन से आप सभी का स्वागत करता हूं और हमारी रविवार के संस्करण में हर दिन हम एक किसी रोग पर व्याख्यान करते हैं और आज हम एंकाइलोजिंग स्पॉन्डिलोसिस के बारे में थोड़ी चर्चा करेंगे. So this ankylosing spondylosis is a degenerative and a chronic inflammatory condition of the spine. So basically, when you have certain degree of inflammatory response, and especially ankylosing spondylosis is mediated by your certain immunological response, which affects your spine, and it causes swelling, stiffness, pain in large joints, fingers, and toes. So initially, when you get this ankylosing spondylosis, you may sometimes just mistake it as a normal back pain. But one of the major cardinal feature of ankylosing spondylosis is early morning stiffness, especially in the neck and the low back. Generally, if you have other types of arthritis like rheumatoid arthritis or osteoarthritis, the stiffness basically is more into the smaller joints in the limbs, but not in the neck and back. So this is one of the differentiating feature. Then, of course, there can be sometimes also involvement of extra-articular structure like eyes. Eyes can get red in the morning when you get up or during the course of day, or lungs or certain blood vessels also gets impacted by the ankylosing spondylosis. So it's very important that you need to be careful about what kind of the symptoms are there. तो एंकाइलोजिंग स्पॉन्डिलोसिस को जानने के लिए ये बहुत आवश्यकता है कि आप ये देखें कि कहीं आपके गर्दन में और लो बैक में यदि ज्यादा पेन हो रहा है और सुबह सुबह काफी जकड़ाहट लगती है नेक के रीजन में, स्पेशली नेक के रीजन को मूवमेंट करने में या बैक मूवमेंट करने में यदि जकड़ाहट लगती है और धीरे धीरे एक पोस्चर चेंज होता है, उनका पोस्चर चेंज हो जाता है और आगे की तरह लोग झुकने लगते हैं. तो एंकाइलोजिंग स्पॉन्डिलोसिस में bambooing on the spine hota hai. There is bambooing of the spine. That means your spine becomes fused and it becomes a stiff like a bamboo, where many of the movements of your spine is not possible. And that's why it's very important that you need to have a good exercise regime to maintain a good quality of life in ankylosing spondylosis. So ये बहुत इंपॉर्टेंट है कि जब आपको ऐसी सिम्टम होती हैं एंकाइलोजिंग स्पॉन्डिलोसिस की जैसी सिम्टम, तो आपके लिए योग करना बहुत आवश्यकता है, क्योंकि योग करने से आपके जॉइंट स्टिफनेस में काफी राहत होती है और उससे मोबिलिटी रहता है. और जो काइफोसिस हम लोग कहते हैं कि आगे की तरह कुबड़ा हो जाना, कुबड़े की तरह जो एक पोस्चर में बदलाव होती है, वो न होने के लिए आपको योग का सहारा लेना जरूरी है. डॉक्टर्स कैसे डायग्नोस करते हैं एंकाइलोजिंग स्पॉन्डिलोसिस? तो जब आपका पेन किलर या एंटी इंफ्लेमेटरी ड्रग्स जो दी जाती है, व्हेन यू आर ऑन दीज एंटी इंफ्लेमेटरी पेन किलर्स, इट रिस्पॉन्ड्स मोमेंटरली, बट देन again you have a reoccurrence, and there are certain other, as I told you, involvement of other eye symptoms, lungs, and blood vessel symptoms. Then we have to go deeper into doing an X-ray. तो हम लोगों को रक्त का परीक्षण करना होता है एंड एक्सरे भी करनी होती है। और जो है उसके बाद रक्त के परीक्षण में करीब करीब बहुतायत लोगों में HLA-B27 नाम का एक प्रोटीन होता है हमारे बॉडी में, वो जरूरत से ज्यादा दिखता है। तो इफ यू आर पॉजिटिव टू दिस specific marker called as HLA-B27, most likely you may have this disease. But yes, there are a lot of other conditions which may be clinically diagnosed as ankylosing spondylosis only. So you can still have ankylosing spondylosis, all the symptoms of ankylosing spondylosis without having HLA-B27 positive. तो हम लोग देखते हैं कि बहुत लोग ऐसे भी होते हैं जिनका HLA-B27 नेगेटिव होता है, बट उनको फिर भी इस व्याधि की बहुत सारी प्रॉब्लम्स दिखती हैं। तो ये बहुत इंपॉर्टेंट है कि आप समय पे इस आपकी व्याधि प्रतिरोधक क्षमता जो है आपके शरीर में या ऑटोइम्यून सिस्टम जो है उसको बहुत अच्छी तरीके से इसका ये करेंगे, आप देखभाल करेंगे। और शुरू से यदि आप हित भोजन, हित आहार विहार का प्रयोग करेंगे तो उससे ज्यादा अच्छा होता है। इफ यू स्टार्ट addressing to healthy diet and lifestyle in initial course of your diagnosis, the outcomes and prognosis are better and we can manage it. As in ABP Research Foundation, I would like to share that Hamari Samstha, our institution is recognized as Center of Excellence in Rheumatology. And for past 15 years, we have been catering to this kind of diseases very scientifically. Before also, of course, since inception, we have been handling this kind of diseases, but as a part of our retrospective analysis and documentation, ankylosing spondylosis has been very scientifically documented at our center, that what are the efficacy, what is the safety of Ayurvedic therapy for this condition. And we have got very encouraging results, and some of the cases today, of course, I'll discuss with you. So one more important fact about ankylosing spondylosis is that there is 3 times more common it is in males than in women, and especially very young male and young female get affected between generally at the age between 20 to 40. Why this is important? Because क्योंकि ये डिजीज, ये व्याधि बहुत अर्ली एज में आ जाता है, in your 20s it comes sometimes. So इसको मैनेज करना बहुत इंपॉर्टेंट होता है क्योंकि ये लाइफ लॉन्ग इश्यू हो जाती है। तो हम लोग आयुर्वेद में याप्य व्याधि कहते हैं कि you have to manage it properly till end of your life. So it's very important to address these issues early, take your therapies earlier, follow the diet and lifestyle very perfectly, so that आपकी जो disability होती है, the disability when it happens in late 50s or 60s, you can avoid those disabilities. And today I'm going to show you 2 cases where we could clearly demonstrate that if you can follow the Ayurvedic protocol, diet, and as well as yogic practices, minimal, you can not only stop the progression, radiological progression, yadi आप bambooing of the spine का avoid कर सकते हैं. You can maintain your normal spine functions, even reverse certain inflammatory process, जैसे C-reactive protein, inflammatory markers like ESR, ये सारा आप normal ला सकते हैं आयुर्वेदिक थेरेपी के द्वारा, and you can bring it to the normalcy and also stop the deposition of calcium into the spine, जो bambooing होता है stiffness spine का. Through radiological proof we have documented कि हमने 11 साल 13 साल के बाद जब हमने उनका MRI किया. When we repeated the MRI for after 11 and 13 years, also there were no radiological advancement in the disease, which strongly supports that whatever we have done. So the patients which we have followed up is not for just few months or a few years, over a decade. We have followed over a decade, and we have created a robust proof that whatever was done through Ayurveda and the intervention was able to reverse certain inflammatory causes as well as improve the outcome. Now, generally, apart from the stiffness which worsens into the night and morning, sometimes they also feel when the inflammation is very high, you get mild fever, swelling in the joints, sometimes also non-neck joints, spinal joint ko chhod ke bhi you can get pain and joint swelling in the other, as we see in certain category of patients where you have fingers of the hands or toes can, get swollen up, feeling very tired and run down, no appetite and weight loss, then stiffening and permanent bending of the posture, pressure on the nerves coming out of the spine. This is one of the major complications when this disease tends to become more progressive. Then you start feeling tingling of the hands, like, because of the nerve root compression. So it can be in the hands, depending on the cervical area, which is getting more stiffer, or even weakness of the leg, tingling of the leg, and weakness of the leg muscles or leg strength. So this is very important, that we should at any cost not allow these complications to happen. And it's very important that we stick to very strict diet and lifestyle regime told by Ayurveda. There can, in some subgroup of patients, there can be also sometimes chest pain, breathing trouble, as well as abnormal heart rhythm. So we address them appropriately with certain herbal medications. As we tell that in Ayurveda, we use a holistic approach where we choose the therapies which are not just for a particular inflammation in a particular anatomical place, but as a whole. So that's why whatever therapy we use, we'll address not only the existing symptoms, but also overall other complications or progression of the disease which tends to happen. So, physical therapy, quitting smoking, and of course, the good diet and lifestyle is a wholesome, is important cornerstone to Ayurvedic management. So I would like to first discuss with you what kind of diet and lifestyle should we have avoided in this condition. So one of the lifestyle issue is sleeping during the day. In fact, in Ayurveda, there are a lot of conditions where sleeping during the day tends to increase the inflammatory responses. So inflammation tends to enhance or increase. So day sleeping is not very good when it comes to this condition of ankylosing spondylosis. Exposure to too much of a place where there is, like, a furnace. If you people who are working in the area where they have to work in furnace, too much of bright sunlight, hot environment around them, it is not good. Then very rigorous, you have to do exercise, that is a must. Yoga and moderate exercise is advisable, not very strenuous and very extreme exercises. Then you need to have a proper sexual life. Don't overindulge in your sexual activity. Then black gram, ulundu, that what we say masha in और इन हिंदी में हम लोग इनको काली दाल जो बोलते हैं वो नहीं खानी चाहिए। हॉर्स ग्राम जैसे कुर्ती की दाल नहीं खानी चाहिए। ग्रीन पीस शुड बी टोटली अवॉइडेड। Groundnuts, it's very important. Peanuts should not be taken in this condition because it's very vatika, we say increases vata and promotes inflammation. Then taking these days a very unique culture is coming up of taking a lot of alkali, like soda khate hain hum log in order to make our system alkaline. That should not be taken, or alkaline water is getting more and more famous. So I think these are situations which you have to avoid. Do not marshy animals, like too much of seafood or too much of fish in this condition is not good. And of course a combination of meat with yogurt or too much of sour cream and all, if you make such kind of combination, it tends to increase the inflammation. So it's very important. Also, please go and read a lot about pro-inflammatory diets which can increase the inflammation. So these kind of things you should avoid. Yogurt is not good for this condition. Sugarcane juice specifically, it's very high sugar content. It like kind of promotes inflammation, so you should avoid. Radish, alcohol, बीटल नट और बीटल लीव्स। बहुत लोग पान खाते हैं, पान खाना इस व्याधि में बहुत अच्छा नहीं कहा गया है, उसको अवॉइड करेंगे। यदि कभी खाते भी हैं तो एक आध बार खाने के बाद you should take it just after food. Then fermented gruel, of course these days there are a lot of trend of using a lot of probiotic, especially overnight you soak rice and keep it the next morning you can eat once it ferments a little. Yes, it's good for other conditions, but if you have an autoimmune disease like ankylosing spondylitis, please do not eat fermented gruels which are kept overnight. So probiotics are fine, but buttermilk is one of the best probiotic for such conditions. Sesame, तिल की कोई चीज ज्यादा एंकाइलोजिंग स्पॉन्डिलोसिस में नहीं खानी चाहिए, और बहुत ज्यादा तीखा, मसालेदार, pungent, hot, heavy food should be also avoided, because and freshly harvested grains. So these are some things which are very much desirable to be avoided in case of ankylosing spondylosis. So whenever I discuss about certain disease condition, I always first give importance to what you eat, because your body is what you eat. And majority of time, even though you may not be eating many of these medicines, either allopathy or Ayurveda, after some time, what will prevent you from getting into these kind of disease condition is your own diet and lifestyle. So it's very important that you should stick to this kind of diet and lifestyle. So what you should take, what are the best food which you should start taking when you have these conditions? So barley is very good. Barley, oats are good for early morning breakfast, porridge. Brown basmati, जो unpolished basmati rice होती है, unpolished basmati rice is very good for this. Various other versions, like local variety of red rice are also good for this condition. Bengal gram, जो हम लोग चना बोलते हैं लेकिन छिलके के साथ, that is very good. Moong dal is one of the best for these kind of conditions. Then mutton is fine. Beef is also fine for this kind of situations. If you are indulging in non-veg proteins, like in terms of non-plant-based proteins, then spinach is good. Then bitter gourd is very good. Karela बहुत अच्छा है. Amaranth अच्छा है. सभी तरीके की गोड्स जो हैं, जैसे लौकी हो गया, भिंडी हो गई, तोरई हो गई, लौका, और all kinds of what we call in Tamil Pirkingai, Patulangai, Pusnikai, Surakai, all these kind of watery vegetables are excellent for this thing. And especially guarfari, pointed gourd and all are very clustered beans are very good for it. Indian gooseberry, amla bahut acha hai. Amla is very good. And ginger is very good for this disease. Yam, elephant yam, जिसको हम लोग सूरन बोलते हैं, ये अच्छा है. Grapes, dry grapes is excellent, has a very good resveratrol, which is antioxidant, tends to be good for this. Petha is good, like very important for this. Butter is good, fresh ghee is good. Meat of animals, of birds like quail is good. So bird, when you have rheumatological condition in general, Ayurvedic books have told a lot about bird meat, different type of. In North India, we say bagro, a small animal, bird hoti hai, jo chirping karti hai. That those meat are better than eating a lot of seafood and fish in these conditions. We have to be very categorical that you should be very clear in terms of having proteins basically in the breakfast and lunch, because हमने देखा है कि it is through our very strong clinical observation that when you take a lot of milk products and proteins in the night, that tends to enhance the inflammation, increase the inflammation बढ़ा देते हैं. तो इसीलिए, क्योंकि अल्टीमेटली प्रोटीन्स एक एसिडिक न्यूट्रिशन है, तो एसिड जब बढ़ती है रात को, और जब आप रात में आपके पचाने की क्षमता कम होती है, when your digestive ability in the night is low, you should stick to mostly like plant-based vegetarian food and avoid proteins even from plant-based proteins. So basically sabzi, roti, चावल वगैरह रात को आप नहीं खाएंगे. You should not eat rice in the night because it is constipative and it's not good for such kind of diseases, please. So these are very important kind of, other very unique thing which we see is aromatherapy. Somehow in Ayurveda, though not directly, but there are use of aromatic compounds in certain diseases. And this is sent to be this use of camphor, either in your food, in seasoning, or in terms of using it as an aroma. In this disease is good. Agar oud flavor is very good as a perfume, as well as aromatherapy seems to have developed a lot independently now, but you'd be surprised that Ayurvedic text has strong kind of references towards these, where we use many aromatic compounds and plants for treating, or when you have this disease, you need to indulge in such kind of lifestyle changes where you use it in your day-to-day life. So this is a unique example, where you can use camphor, agar, oud, cedar wood, cedar oil, pine oil. All these things can be used even for pain killing. So we know that all these oils also have a very good anti-inflammatory and analgesic or pain-killing effect. So these blends from these oils can be looked into to even apply it on places where you can have a pain due to this inflammatory condition, or even in terms of using as perfume and other things. So this is the first part of my discussion today, that ankylosing spondylosis, yes, it's a challenging condition, but through our consistent documentation and practice-based evidence, we have been creating a very robust scientific data as to what we can do in ankylosing spondylosis. In the last part of my presentation, I'll show you a case. As I was telling you, it's a case of ankylosing spondylosis, and this patient is a female patient, and this patient had come almost her first visit was in 2013, and she has been to our hospital, but then she already had, before she came to us, these diagnosed ankylosing spondylosis, and with all serological tests. So HLA-27 was positive already, and she had been taking several conventional medicine for 7 years, also for other conditions like typhoid and other thing. So what we have seen is, which is getting more and more also evident, that many of the patients who may not have had a family history, generally sometimes we see a strong family history of this diseases in certain patient. But in this case, what we found out that a regular use of antibiotic would have probably kind of, and also painkillers and steroid would have had a great impact on the gut microflora. And slowly there are a lot of body of evidences now getting published in scientific journals that that gut microflora plays a major role in kind of, inflammatory diseases like ankylosing spondylosis. And there is a strong relationship between gut microbiome and inflammation in gut to the inflammation in the spine like ankylosing spondylosis. So this lady patient had come in 2013 to our consultation, and there is a very important scale which we have to kind of measure the quality of index of or well-being. Is called as kind of BASDAI index and BAS5 score, which basically talks about, first is how is the patient's inflammatory response or the clinical status, and then we start doing a prospective observation as to. So, and 2013, this lady had a BASDAI score of 4.9 and BAS5 score of 8.3. And usame you can see that there is a high C-reactive protein, almost normally is around 6, 19.9, and MRI showed that there is a mild kyphosis developing with inflammatory response in 2013 with a congenital fusion at T12L1. So since there is a congenital fusion already in vertebral that we can't help out, but then can we work on maintaining the lumbar lordosis as well as the neck curve which we have, and can we stop from development of the bambooing of the spine. So we can see that over 2013 to 2021, she had almost 38 OPD visit, outpatient visit, as well as 1 IP visit, that means inpatient therapy. And we could see that there were certain remissions and reoccurrences. So remission happened in 2019 till 2019, 2013 to 19, but then she had a road accident, and then again she had a small flare-up. And this brings up a very unique concept in Ayurvedic text, which is told is in Vata Rakta. So generally, the line of therapy in Ayurveda is based on treatment of Vata Rakta, Amavata, and Vata Vyadhi in general. When we look at with different phases of ankylosing spondylosis, when ankylosing spondylosis is in a state of inflammation, acute inflammatory response, we have seen that Amavata treatment strategy works. There's no doubt. Or Vata Rakta treatment strategy with Ama, whatever has been told, works. And when you go to more deeper long-term symptoms of the ankylosing spondylosis, then we see like Asthimajja Vata Lakshanas, and there are certain Sarvagata Vata Lakshana. being evident. So in purview of overall major symptoms, but then yes, if people are with symptoms of Pandu, people have symptoms of sometimes Rajashma also we see, or different Shalakya conditions of the eyes and Abhishanda and other things. So we need to appropriately address those issues concurrently. So what we have seen is that the BASDA score, which in 2013 was 4.9, in 2022 has become 0.9, and BAS5 score, which was 8.3, has become 0 in 2022. So what we see is, it's not that even laboratory investigation, if you see C-reactive protein has almost come to 7, which 6 is the normal. Now, from 19 in between, when she had an accident, it went up to 68, and then it again came back. And the worth noting in this condition is that there was no allopathic medicine after 2013, and she had 2 live births because she is young, and she had a 2 live births during this this whole 2013 to 2022. Now, what also is advantage we can see is it not only reverses inflammation, improves overall quality of life and clinical response, but also probably this is one case where we also see that safety of Ayurvedic therapy, because therapy from 2013 is continuously, she's a very efficient and compliant patient. She's been continuously taking these therapies. So we can see that the response continues. And if you look at these, I would like to show you certain MRI. So you can see this is 2000, the first one is 2013 MRI, and the same, you can see there is a congenital fusion of these lumbar. We can still visualize that, but the best part is the other part. There is no osteophytes development, there are no fusion happening of the spine, and both of them shows that there is no change in significant change in the MRI finding. So across several years, like at least this is you can see across 7 years, almost 6 to 7 years apart, these two, there was no changes in the MRIs. And we can see that BASDA scored for 4.9 to it has come to 0.9, and also it has come to from BAS5 from 8.3, that is daily scores. So basically, as I told you, the BASDA and BAS5 are qualitative assessment as to how they are doing their daily scores, daily quality of life. They have almost become normal after the therapy. So this is if you look at overall quality of life, has, because of continuous, if you see the Ankylosing Spondylitis quality of life questionnaire 2013 to 2012, she has never, because of her continuous intake of medication, she had not had a compromised quality of life. So it is well maintained. Now, this is a very strong empirical proof that Ayurvedic therapies can do wonders in terms of kind of whenever you are doing a such kind of intervention. Another case I would like to show you is, I was telling you about a male case. Again, this two are the MRIs of the same patient across. The first was done in 2013 again, and now it was done in 2023. If you see across 10 years of this MRI, the male patient, if you look at their the spine, which was 10 years back and now, do not show significant changes. The neck curvature is almost maintained with minimum changes as such. And the best part was that there is no sacralization, or there is no ossification of the bones or the vertebrae. And then patient, of course, has some stiffness in the neck, but it's maintained over last 10 years and have not deteriorated over time. So what we observe from all these instances, so these are only 2 examples of what we are doing right now at AVP Research Foundation to address this inflammatory conditions in terms of improving the quality of life and long-term follow-up. It's very important that being the proponent of holistic and integrative approach in managing such kind of disorder, which can create disability. In fact, this disorder is something which happens very early in your life and then tends to create disability in the latter half of your life, which has to be definitely managed well. So the message is, since the disease itself is diagnosed very early when you are young, so wake up call for all of you. If you embrace Ayurveda along with whatever therapy you are taking, we can integrate Ayurveda with whatever therapy, or even in these cases we are seeing Ayurveda alone along with yogic intervention can bring about a very significant change in the disease activity, maintain your good quality of life and well-being. So do post your questions and visit our website to consult us who are treating ankylosing spondylosis for last almost 2 decades, and do visit our website, AVP Research Foundation. Thank you for your patient listening, and in the service of Ayurveda, we wish you a great Sunday. Thank you.